Welcome back to this edition of Community Health Matters, exploring behavioral health services treatment at North County Health Services. Joining us now is Dr. Shayna Walker, Director of Behavioral Health at North County Health Services. Welcome, Dr. Walker.
Thank you so much for having us.
What is your specific role with NCHS?
Well, I first joined NCHS as a family medicine provider and a psychiatrist. I'm double boarded and trained in both aspects to take care of the whole person. Now I've stepped into the role of behavioral health director, and I'm doing behavioral health services for the entire organization.
Wow, that's a lot. You must
Exciting.
You must have busy days.
Yes, yes. This is a fun day.
So what are some of the conditions frequently associated with treatment at your clinic?
Absolutely. We see the gamut of spectrum of diseases. I think, and I think it's important to know that they affect everyone, whether you have $1 million or $1. Behavioral health can affect multiple people. So we see depression, we see anxiety, and there's different types of disorders within those kind of major categories. We take care of some folks with severe mental illness who have psychosis or other long-term chronic psychotic disorders, and we manage that too with a lot of support from their family members and other services.
Now, you mentioned when you started, you were you said medicated. Could you give me that
I'm
word?
a family medicine doctor. Take care of delivered babies all the way up to geriatrics. So I'm trained to do that in addition to psychiatry and classic behavioral health.
So what is medication management treatment, and does the dissemination of this treatment vary for different ages?
Yes, yes. So medication management treatment are the classic medications that unfortunately we see a lot of commercials on now, the medications that are approved for depression or anxiety or for mood disorders. They vary. There's more medications now to target behavioral health disorders than ever in our history, which is very exciting that research is being done, work is being done to really help folks recover from these severe medical problems, which they are a brain problem, a medical problem. They're not, no one acts to feel depressed, no one wants to feel anxious. It's a problem, just, I think of it just like chronic conditions like diabetes or asthma. You have to manage it. You have to get help for it and integrate into a family setting where you get help with primary care providers, with therapy providers, with psychiatry providers, or people who prescribe medications for these disorders.
The Medicaid management treatment, as it fits into what you're saying, you assess could you speak a little bit about that?
Absolutely. Yeah. So we do a full evaluation to figure out what we're treating, whether that's depression or anxiety or bipolar disorder or schizophrenia. We evaluate what we're treating. There's different medications that are approved for each of those disorders, and we are very safe as far as which medications will be most effective for clients, that they're going to improve their quality of life. They're going to get them back to functioning. They're going to get them back to working and in school and all the things that we want for their lives, that people want for their lives, to be stable, to not fail out of school or not able to complete their work. I'm always looking at how can I get you back to your best functioning, because your life is you're not supposed to feel depressed for your life. You're not supposed to feel miserable for your life. So we want to get you back to that level of functioning. And medication sometimes with therapy have been shown to be the best way to do it.
So medication with therapy. And is there I don't know if the word is an end to the medication. Is it something that you have to constantly be on for the rest of your life, or can you get off?
It depends on the disorder and depends on the chronicity of how long a patient has had a symptom with that disorder. So for instance, if it's the first time a young client has ever had an episode of depression, we might treat for 6 months to a year and then take off medications. If there's been multiple episodes of depression or anxiety or something that's been long-term in that client's life, I want to keep you in a maintenance phase so we don't have recurrence of symptoms. So I want to keep you on medications to keep you stable, safe doses. I think we never want to hurt anyone. The goal is to help, never to hurt. So if the medications are hurting you, it's never our intention, and I think having a comprehensive team of folks where we have therapy, we have psychiatry, we have all the the pieces in place, we can really get you to the best level of functioning. And I think we do that well at North County Health Services.
So, because you mentioned young people, so does the Medicaid management treatment, does that differ? How does that differ for the younger people? And when you say younger people, what is that age group you're kind of identifying?
So we take care of children all the way up to, I have 80-year-old patients as well. I think for children, there's just a lot of evaluation, family support, therapy support that we want to involve. I think that's for every age, but we're even more cautious with our young folks who are under 18 years of age, talking with the family members, making sure they're on board with what we're treating them with, and just being more proactive with, let's make sure we're increasing their functioning. Are they going to school? Are we doing alternative ways to get them their education, to get them successful?
So when you talk about this medicated management treatment, are you curing? Is that the right word? I used it before. I'm not sure if that's the.
I think it's resolving a medical concern. You know, think about diabetes. That's why I always bring it back to primary care. If diabetes sometimes cannot be cured, but it can be managed really well, where people don't need medications. That might be where we end up with behavioral health disorders, where they might still see me. I'm not prescribing any medications, but we're checking it. I want to be that net for them in case of something happening. We want to be the support system long term.
And how important is screening and integrated care for patients?
So important. I'm from the primary care world. So I know that's the first point of contact where patients will say something, whether it's a physical symptom, I can't sleep, or I'm having stomach upset, I'm having chronic headaches. Those are the initial warning signs that our primary care providers are doing the majority of behavioral health treatment in this country, and they are the first line to screen and get folks engaged into care.
Are there any other kind of alternative treatments or therapy practices other than the medication?
I think there's a lot on the horizon, and it's exciting because a lot of these alternative treatments are being approved by insurance, which is very exciting.
That is exciting.
Like acupuncture and different types of therapies. We have a program for pain management. It's called neurofeedback at our organization. Where we try to decrease the level of stress related to some of the chronic medical conditions of chronic pain that can be linked to depression and anxiety. Light therapy, which just sounds, odd, but 30 minutes of sunlight in the morning can be just as effective as some mild types of treatment. So it's very exciting that a lot of these things are there. The gamut of what we want to serve for patients, the spectrum of what we want to kind of target and help patients with, we go outside the box for each patient because every person deserves to feel better.